Since the pandemic, more patients are turning to email or text for medical advice, and now some of the nation's largest hospital systems are deciding it's time to charge for that response. A new study from the Journal of the American Medical Association shows the fees vary, but they are as little as $3 for Medicare patients and around $20 for patients with private insurance, up to $100 for uninsured patients just to answer medical questions. We're going to welcome in a doctor and ask him what's up. Interventional neurologist and pain management specialist Dr. Chad Demang is here. He's joining us live from Louisiana. Dr. Demang, thank you for joining us. This sounds like what attorneys do. Why are physicians going to charge fees to respond to text messages and emails from their patients?
Yeah, that's a good segue. As someone has hired an attorney, every text, every email, every phone call gets itemized in a bill. You know, there's two sides of this argument. You know, there's a physician side and there's a patient side. So as a physician, you know, I've been in practice for 14 years. What have I seen for 14 years? Reimbursement goes down every year. My overhead goes up because of inflation. And then on top of that, the third thing we do as physicians is we have to work harder to do the same thing we did the year before. So we have to get more staff members to go through pre-certifications or answer emails or phone calls. So it's a very difficult financial issue for the doctor. But look at it from the patient side. Their co-pays are going up, their premiums are going up. And as a patient, as a father and a son, they don't want to have to pay for an MRI result, a lab result. So for a patient, they're just looking at the same financial constraints saying, why am I having to pay for this next thing? So in my practice, I get about 200 phone calls a day. I get hundreds of emails a day. I'm a single doctor. You know, I employ 20-something patients. 20-something staff members. So you can imagine this overhead battle with maintaining my relationship with the patient. And so what you're seeing and what we've seen in medicine is that doctor-patient relationship is getting ever more strained because we're caught between keeping our lights on and keeping the level of medical service that we would want for our own family with our patients. So this is a very difficult issue.
Well, I think that makes a lot of sense. I have my brother-in-law and my sister-in-law are both doctors. They say they spend most of their time not dealing with patients directly, but looking at emails, taking notes, answering texts and phone calls. But, you're hanging out your own shingle. You're a single doctor. This is talking about large hospital systems that are doing this. And you would think that they would have some infrastructure in there to help their doctors out, to not have them be overwhelmed as you might.
Yeah, that's a great conversation because I used to run a hospital. In Hammond, Louisiana, we have the last physician-owned hospital in America. So I was the manager, so I can speak to that in as well. But you're right, the hospitals have so much more infrastructure, and from a medical dollar, they make so much more than a single physician. So, for example, I'm about to do clinic. I'm going to order MRIs. I'm going to send referrals. I'm going to order labs. I'm going to do all these things that as a physician, there's no reimbursement to that, but the hospital obviously makes money on every single medical entry point through this system. So you're exactly right. From a hospital standpoint, they should not be taxing a patient as much because they have much better electronic medical record systems. They have multiple staff members. So I agree with that statement, but where I see this as a single physician, these type of things are making it hard for us to exist without an affiliation with a hospital, because even telemedicine, for example, during the pandemic, we don't make a full billable service as if I saw you in person. So right now, if I do telemedicine, I'm getting about a 30% reduction on reimbursement versus seeing in person. So there's just so much to this conversation, but you're exactly right. With a large network, a large hospital, a large medical system, they should be able to provide some level of service that's obviously much cheaper than the numbers you just showed.
Yeah, and hopefully this doesn't deter patients from possibly contacting their doctor because they don't want to pay for an email or a text. But that's another conversation for another day. Dr. Chad Demang, thank you for joining us.
Yeah, thank you. Appreciate it.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.